Hi, everyone, and welcome back to another episode of Mindful Marathon Conversations. I'm your host, Dr. Michelle Quirk. I'm a pediatrician and a run coach and the founder of Mindful Marathon, where I help make running easy and fun for busy professionals. And I'm very excited to welcome my special guest today, Dr. Tea Nguyen. She is a foot and ankle specialist focused on preventive and holistic care using minimally invasive solutions so that people can stay active without pain or deformity. She is deeply passionate about preventing leg amputation in those with complex medical conditions like diabetes and neuropathy. And she believes that everyone deserves to walk, run, play, and travel without foot problems, which we can all get behind. So welcome to the show, Dr. T.
Thank you so much. You read that so well. I'm like, who's she talking about?
It's you. So thank you for
Thanks.
joining us. Tell us a little bit about yourself and maybe why you got into the specialty that you did.
Yeah. Well, I'm T. I practice in Santa Cruz, California. I opened my solo practice in 2018 because I was pregnant. So I had my daughter and my business the same year, which is kind of like, who does that, right? Apparently you can do that. So I had two babies simultaneously is what happened. So I'm also a wife to a general surgery husband, and I love sharing that because he's a general surgeon, so he does head to toe, a lot of abdomen work, but he also gets called for below knee amputations. And who does he call when he needs help with some of the anatomy? So it's, he calls me, he goes, "Can you show me how you do like the flaps and the amputations?" And I'm like, "I'm all in there. Like I know what muscles and structures are in there, what to ligate." And it's just a really wonderful like reason to be in medicine when I'm doing what I love with somebody that I love. And
Yeah,
that's what I do. I try not to amputate. It's not like I'm trying to do them, but
yeah, yeah.
I love the lower extremity anatomy. I love the biomechanics. I love the complexity. It's not just the foot. It's attached to a person who has real life goals. Like in your case, all of your athletes have goals of running without pain or with less pain, which is it's a little bit of an oxymoron because running is painful for me. So I imagine there is some pain with running, right? It's not supposed to be all that easy. But anyway.
Yeah, we could talk about
There's a
that.
growth pain. Yeah. Mhm.
Yeah, yeah. Yes. I think that I wish I had known you maybe a few years ago. I injured myself, not running. I was gardening and I tripped and kind of rolled my ankle in my garden, and it was a whole thing. But
Oh.
I learned a lot about the foot and the itty bitty bones of the foot and the navicular bone. And anyway, I would have phoned a friend had I known you then.
Oh, perfect. You can phone me now. I'm sure that won't be your first or your last.
Exactly, exactly. Well, tell us maybe for the runners out there, if you could give some advice for maybe, I don't know, like foot health, good foot care. If you have advice about that or sneakers, I have many questions.
Oh, yeah. Perfect. We can start with general foot health because foot hygiene is not a thing that we typically think about. We think about our oral hygiene, but we don't really look at our feet in that way. We just think there's something to walk on. If it doesn't hurt, we don't really care that much about it. And then one day we develop athlete's foot, or we get toenail fungus, or we wake up and the first steps hurt really bad, or you step in a gopher hole, or you're in the garden and you sprain your ankle, and then it matters, right? So we want to pay attention to our feet, and I want people to care about their feet as much as they care about their face, that it's
Mm,
something they look at every day and they know what it looks like today so that when something looks a little abnormal, like the nail color changes or the toes start to change shape and become hammered or a bunion develops, they know to recognize it. And we all know prevention is the best treatment, but the next best thing is recognizing something's changing early on and getting that professional assessment to decide if there's something more we can do to prevent long-term problems.
wow. You make me want to go look at my feet right now.
I encourage it. You have to know your body.
You're very right, though. I do tend to ignore them most of the time, which is a problem. Can you
Well,
talk?
lucky for us, we're healthy, that it's not that big of a deal, but once we start incorporating it to our day-to-day regimen, it gets easier as we get older. I mean, try
Yeah.
telling an older person, now you have to add on this thing to do. Then it gets a little bit more challenging because you're like, I already have a laundry list of doctors I need to deal with. Now you're telling me to do more.
Yeah,
So we might as well start easy now.
exactly. A little bit at a time.
Yeah.
Can you talk a little bit about the change in the nail color, like what that might mean and what we're looking for?
Nail color changes. It's a whole rainbow. You can have a whole rainbow of colors to your toenails
Mhm.
because it can range from something like as a runner, you get bruising. And that can happen because your foot is constantly pistoning to the edge of your shoe, or your shoe is tight, or your
Yeah.
toes are hammering. That's very common in runners where your toes are like constantly out of grip. So you're smacking your nails against the ground and it can get damaged or thicken. So we
Mhm.
call that micro trauma. And your body responds to micro trauma by thickening the nail. And
Okay.
sometimes that can look like nail fungus too. And nail fungus can cause the nails to change color, usually in the yellow beige arena. Bruising comes in the color of purple, maybe brownish tinge.
Mhm.
Melanoma can also exist under the nail that can look more of a dark black streak, which can be confused for melanechia, which is a pigment, a benign pigment that also grows in the nail that's seen in different colored skin. Darker skin colored people can have these striations that can be concerning if we're not culturally trained to look at these different nail colors. So it does really come in a variety of
Yeah.
colors.
Wow. Do you recommend that, especially for the runners out there, should we be seeing you, like once a year, kind of like we see our, family physician or internal medicine doc for a checkup of our feet?
Oh, a tune-up for your feet? Yes. I love seeing runners because oftentimes they come when it's kind of late. Like
Yes.
I've had this ingrown toenail and I've been plucking at it and now it's infected. Or, I've been wearing the wrong size shoes, but I didn't know it and my toenail has completely degraded. It's fallen off. Or now I need a hammer toe surgery because I didn't know better. So it's always nice to touch
Mm.
base just the one time, just to get a general assessment for a pass or fail. Like a car inspection, everything's running good until it's not.
Yeah.
But might as well catch it early. So for runners, I love sharing things about their feet because a lot of times they just don't know
Yeah.
that their feet are correctable. So
Yeah.
they may say, I've been running with this heel pain for so long. I thought that was just normal. When in reality, that was a plantar fasciitis issue that
Mhm.
can be corrected with exercise strengthening, focus exercises, and maybe a little cushion or even a custom orthotic.
Yeah. Oh, this is great advice. Um, in terms of sneakers, I mean, a lot of people ask me about what is the best sneaker to get and all of these things. And I usually advise to go to the running store and get fitted and all of those things. What would be, your feeling about sneakers? How do you feel about the ones that, the ones that don't really have cushion? They're kind of, I forget what you call them, like
Like
the,
the barefoot,
yeah,
like this,
yeah,
like you're playing piano with your toes. Yeah, I know what
yeah,
you're
yeah,
talking about.
yeah, yeah.
Yeah.
I've never tried those myself, but I do have several people who are fans of those.
So shoes, it comes in a variety for a reason because we all have different preferences, whether it's texture or comfort or even foot types. So there isn't one shoe for every single runner. And there isn't a barefoot movement for every single runner. It's personal preference. So I like that it's dynamic. The shoes that we choose for the activity we want to do them for, it's dependent on what feels good to you. And there's there's an endless amount of criteria when it comes to shoe, but what I like to do when patients ask me for shoe advice is I connect with my local running shoe store. They have training programs and coaches here as well
Mhm.
who can better assess the person's individual needs. If they don't have pathology, they can assess the shape of their foot and then make recommendations for the shoes that is best suited for their activity.
Yeah.
So like a sprinter, their shoe requirements are going to be way different than a marathoner's shoes.
Yes.
And for most of the people that I see, it's really they're just looking to run maybe a couple of miles, maybe walk a little bit. And I do prefer shoes like Hoka. They have really good cushion. But Hoka shoes aren't for everybody because there is a rocker bottom to it. So it accelerates how you move.
Hmm.
And so it feels like you have a little bit less control. And that can be an issue for people who have balance issues. It just may not feel really good for some people.
Hmm.
But I like to start people off with the shoe store that is designed for runners because they'll know their runners better. And then I can just look at the biomechanics. Do I need to do any minor modification to that shoe?
Hmm.
Which could be something super simple. Like if they have pain at the ball of their foot, I can take a pad and I can just stick it there and take the pressure off of that so
Hmm.
that they can remain functional without having a whole shell of an orthotic.
Yeah, yeah. Yeah, orthotics. I've run with super feet before when I had my ankle foot issue. And
Uh-huh.
that really helped me to get back, to where I was. So I ran with it for probably a year or so. But I've been out of them, but it was really helpful with that injury.
Yeah, I like super feet. I like a lot of these over-the-counter inserts. They really should not fold in half, and people mistake inserts for custom orthotics.
Yeah.
So inserts are off-the-shelf things you can just purchase without a prescription, whereas a custom orthotic, it's like glasses. It has to be prescribed for your anatomy, for your specifications. So they're not interchangeable.
Hmm.
In your scenario, it makes total sense that the super feet works for you.
Yeah.
Whereas somebody who has more of a flat-footed type and they're developing tendinitis, then they would probably need custom-made orthotics because they're a lot more rigid, a lot more durable, and they can control the heel a lot better than the inserts you can buy at the store.
Yeah. No, that makes perfect sense. Um, Along these lines, I guess, do you have advice? Like a lot of my runners get trouble with blisters. And also the toenails we talked about. Yeah, the black toenails and toenails falling off. Lots of toenail questions. But do you have advice for blisters? I I have an idea what I usually try to tell them, but I your advice will be best.
I mean, one advice, I don't know if it's the best, but blisters develop because we created friction somewhere that shouldn't have friction, that chronic running, that pistoning of the shoe that maybe doesn't fit well. So first we want to know, why did the blister develop? Once you get to the reason why it developed, sometimes it's just the shoe or the sock thickness, or it was too thin, or it was like an ankle sock, but you're wearing a boot, a high
Mm,
top, and you gave yourself a blister. So let's find out why you have that blister so we can get to the source that maybe it was the shoe, it was in an improper shoe for the activity you were doing.
yeah.
Another way to prevent it, a way to prevent that besides shoe modification, is I like to prescribe or recommend silicone tape.
Hmm.
And they're very soft and they feel just like your skin, and it's nearly invisible. So I remember putting on silicone tape on myself between my toes, forgetting that it was even there. So I had it on for several days. And I was like, wow, it's really soft. You don't remember that it's there compared to a Band-Aid. You know that a Band-Aid is there.
Yeah.
But silicone tape is super nice. You can buy that on Amazon. It's called silicone tape and
Hmm.
it comes on a green roll. So wherever you tend to get pressure points or a blister, that's a really nice place to put it on. So you prevent that friction between your shoe and your foot. So
Okay.
silicone tape is my personal favorite, but you can also do other things like moleskin. And
Hmm.
if you're just kind of in a bind, regular skin tape or band-aids will work as well.
Okay. Okay. No, I might have to invest in a roll of the silicone tape. And it
Oh,
would
do you get
travel
blisters a lot?
only after very long distances. Yeah.
Yeah.
Yeah. Like a
Mhm.
regular my regular routine, no. But yeah, usually after like a half marathon or something like that. Yes.
Yeah.
I imagine it's just a matter of more sweat, like more moisture and friction.
Yeah, definitely. And it's not like you can stop midway your marathon and be like, let me put
No,
on some tape. We don't do that.
no.
Yeah. And that's kind of just that's the price we pay for doing these things that, humans weren't really designed to do, but here we are pushing ourselves. So we have to accommodate that. Yeah.
I have one more question that I get every once in a while about like pronation and supination and shoes that are made to correct pronation. And I don't know a ton about this, but people ask, and I'm never sure what to say. My advice again is always go to the running store and get fitted. But
Mhm.
thoughts on supinators and pronators, and is there much of a difference? Should we try to correct this or not?
Oh my gosh, it's almost like fingernails on a chalkboard.
I'm sorry.
No, 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 no. It's like what I have patients who come in and they're like, I'm a pronator. And I'm like, yeah, we all are. That's how our feet adapts to uneven ground. It's why we move. So being labeled as a supinator and pronator, it's like, what do you mean by that? Are you actually having pathology? Are you actually
Mhm.
having a strain, a tendonitis? Then we can say it's because you are overpronating versus I'm a pronator, like without pathology. So
Okay.
this is kind of a space where I think we really need to dive deeper into, like, why does it matter if you're a pronator if you don't have symptoms, right?
Perfect.
Yeah, you're normal. If you pronate, that is a normal function of your body. That's how you adapt to uneven surfaces.
Okay.
Now, severe pronation causes symptoms like posterior tibial tendonitis,
Mhm.
or it can lead to flat-footedness. So there is a level of pathology that's important to protect. And that's why a lot of these shoes are designed to neutralize how much you move, because if there's too much movement, you can cause strains in your lower extremity and upper body as well. It goes up the chain.
Mhm.
But if you have no symptoms and you've been running marathons for eternity and somebody decides to sell you a shoe and they're like, you're an overpronator, but you've been doing fine, that's where I have a problem. It's like, it's not a pathology until there is a symptom.
Oh, I love
And then
that.
supination is totally different. Supination is when your feet tends to go out. It looks like
Mhm.
you have a high arch. That's a little bit more problematic because there's less adaptability. And so you can put yourself at risk for ankle sprains even.
Mhm.
So that pathology is a little bit different, but some people have a naturally high arch, which means it's a little bit harder to find shoes that fit well. And so,
Okay.
when you find that pair of shoes, stick with that brand because it's going to always work for you. Like, don't change too much.
Yeah, yeah. I know. I feel like a bit of a creature of habit. Like once I've found the ones that work, I'm sticking with it until the model changes in some way.
Yeah.
If it
Yeah.
works, don't change it.
I understand now our elderly population when they hate change.
Mm.
I totally get it. I'm like, you know what? Me too. I'm that age where, yeah, change bugs me too.
Well, that was great. No, thank you. That was like a master class in pronation. That was good. Thank you.
Oh, good. I'm glad. I'm gonna piss off some people about that because there are
Oh,
some educators out there who are just like, if you pronate, you need this shoe. I'm like, if it's some asymptomatic, what are we doing? We're just making them more dependent on something that they weren't
that we
dependent on
didn't need. Yeah.
before.
Thank you so much for joining us and for sharing your knowledge with us. Tell the listeners where they can find you and seek your help if needed.
I would love to meet everyone. Every pair of feet needs an assessment at minimum because you don't know what's wrong until you look at your feet. And a lot of us, as we get older, we don't have flexibility to see the bottom of our feet. And that can give us a lot of trouble. And even between your toes, like you don't want to miss that either. So if you need a little bit love for your feet, you can find me on Instagram at Dr Tea Podiatry. And I would love to connect.
All right. And you have a podcast as well.
Oh, yeah. I have a podcast, but it's for coaching. It's for physician coaching. So it's a totally separate thing.
Oh, okay. I'll delete this part. That's fine. Unless you want me to put it in. Do you want me to put it in? I can.
No, but I have a YouTube channel called Tuesdays with Dr. T that's intended to bring more than just foot information. I'm bringing in all of the medical experts in their field. And I'm going to invite you too, Dr. Quirk, to be on there for my audience, for my patients, to talk about how to get started in running.
Oh, I would love that. I would absolutely love that.
Because,
Well, thank you.
I don't love running. I'm sorry. You can cut that out.
No, it's okay. Well, maybe, after we chat, maybe I can change your mind.
Yeah.
Well, thank you so much for joining us. And I will leave the links below. And thanks everybody for joining us. And we'll talk to you soon.
Bye.
Thank you so much for joining us for this episode. If you liked it, please subscribe and share it with a friend. And if you are a newer runner or a runner who hasn't run in a while and you're looking to get back into the sport, you can find out how to work with me over on my website, which is mindful-marathon.com. See you on the next episode.